The Health Insurance Portability and Accountability Act, or HIPAA, of 1996 was passed to improve the efficiency and effectiveness of the healthcare system. HIPAA is a broad federal legislation that includes rules to protect the privacy and confidentiality of patient information. It did not replace existing confidentiality laws, but it does establish minimum requirements for health information, including privacy, security, and the establishment of standards for electronic transmission of certain health information. In this section, we will detail the following points: areas covered by HIPAA, protected health information, consents and authorizations, use of ePHI, and incidental disclosures. HIPAA has specific rules concerning insurance portability, or the ability to move records to another employer, and insurance coverage will probably not be denied. HIPAA also addresses fraud, enforcement, and accountability. HIPAA regulates the use and the disclosure of what is known as the Protected Health Information, or ePHI. ePHI is any information that can be used to identify the past, present, or future health care of an individual, or the payment for that care. Patients have the right to direct when, why, and to whom protected health information may be released. Protected health information is virtually all information about a patient, whether written on paper, saved on a computer, or spoken aloud. It also includes virtually any information transmitted and/or maintained in any form, including prescription records, billing information, patient profiles, and oral communications on the phone or during counseling. Protected health information includes the patient's name, address, age, social security number, other personal information, license plate numbers, fax machine numbers. HIPAA Confidentiality and HIPAA Privacy Act also protect the following: the reason the patient is sick or in the hospital, the treatments and medication they received, the caregiver's notes, and information about past health conditions. Upon entering a healthcare organization, the patient is given information about how the organization will protect the privacy of the patient and what type of information will be shared and under what circumstances. This notification is called the Notice of Privacy Practices, and under HIPAA requirements, this must be given to all patients. In general, a healthcare provider can access and use protected health information without specific patient authorization, if it is to be used for treatment, payment, or healthcare operations. Any other disclosure of PHI requires an authorization by the patient. Legally, protected health information can be used for treatment payments and operations. Treatment can include referral, admission, consultation, diagnosis, and treatment planning. Payment includes payment for services to a patient or in preparing claims, submitting bills, and any collecting actions. And operations can include most administrative functions, quality improvement, peer reviews, compliance, fraud and abuse protection, business planning, complaints, and grievances. A physician's office or hospital may use protective health information to meet state or federal law public health reporting on child abuse or neglect and on certain infectious disease such as HIV or TB, and vital statistics such as births and deaths. These reports can be provided without patient authorization. A healthcare provider can also disclose PHI without patient authorization for public health activities, law enforcement or when required by law, and other national priorities such as to funeral directors, organ donation, research, prevent a disaster, special government functions, or for workers' compensation. When disclosing protected health information, always use or disclose only the minimum amount of information necessary to honor the request. Always check with the supervisor, department compliance representative, or the compliance officer when unsure what to disclose. Patients have the right to refuse the disclosure of protected health information in some circumstances. For example, if the patient wants to be included in a facility directory, this disclosure could be the patient room number in a hospital or the patient's general condition. Patients can also decide if they want a close family member or friends to stay informed about the patient's care or payment. Patients can decide if they would like disclosure of protected health information to the patient's employer or disclosure for marketing purposes. Protected health information may sometimes inadvertently be disclosed. It is not a violation if the disclosure was accidental. For example, a discussion between a patient and a doctor in a busy ER would not be considered a violation if the conversation is overheard as long as reasonable safeguards were in place, such as speaking within a lowered voice or using privacy curtains. PHI should never be discussed in public areas such as elevators, cafeterias, waiting rooms, or gift shops. HIPAA guarantees that the patient's right to request communication by alternative means. For example, the patient can use a telephone number or address that is different from the information on file for that patient. Patients are also guaranteed the right to get a copy of their medical records to inspect and to correct errors or amend their records. Patients can inquire and be granted information on who had or has access to their records and can seek penalties if their medical information has been used inappropriately. Privacy is an individual's right to decide who, when, and how information about them is disclosed. HIPAA security is extremely important, and all facilities have the responsibility to keep the patient's medical records private and confidential. Protective health information, or PHI, is considered as electronic protective health information, or ePHI, when stored, maintained, or transmitted in an electronic format. HIPAA security rules also apply to ePHI as well as PHI. All rules that apply for PHI also apply to ePHI. Electronic protective health information is considered anything that could identify the patient, their medical condition, and their method of payment. To protect electronic protected health information, computers and other electronic technologies must ensure that they are used appropriately. Employees cannot use their personal computers or review personal or family protected health information. When using a laptop, tablet, computer, or removable storage media, it is the responsibility of the employee to obtain approval before transferring electronic protected health information to a portable device and protect all electronic protective health information from electronic or physical invasion or theft. When transferring ePHI, remember that information and images sent over the internet or email will not be encrypted and should be transmitted on secure servers only. Emails with electronic protected health information sent from a personal computer are not considered private. Most companies can now perform email and internet audits to check on usage and violations of HIPAA rules and policies. Correct use of ePHI involves signing off your application and computer after finishing a task, using a strong password, and protecting your password. Never sharing your password, and report changing your password if you believe your password has been compromised. Each organization will have specific guidelines on how to protect electronic protected health information. Some suggestions are: keep patients' information confidential. Do not discuss patient information such as medical records, diagnostic reports, or surgical lists with friends and family. Follow the need to know rule. Before opening a file on a computer, ask yourself, do I need to see the patient's information to perform my job? If the answer is yes, you can open the file. If the answer is no, stop. Do not discuss patient information in public places, such as the cafeteria or elevator. Do not post patient information on any of the social media sites, and never send electronic protected health information to anyone unless you have verified who will receive the information and how the information will be used. When sending emails, follow the rules of the facility. Do not put the patient's name or ID in the subject line in an email. Be certain you have the correct email address and check for similar email addresses, such as endings like .net, .com, .att, .edu, etc. Only send necessary information in the email. Your facility may have a standard disclaimer at the end of each email that is sent. HIPAA also covers fax communication with specific patient information. Although each organization will have different specific policies, general outlines or general guidelines can include the following: locating fax machines in private and secure areas, which are away from patients and the public. Fax cover sheets include a disclaimer to indicate what to do if sent inadvertently to the wrong number. Whether faxes can or cannot be sent during off hours, when the incoming fax papers will not be picked up immediately, and protection of sent faxes left unattended on the fax machine. Social media should never be used to post about or transmit protected health information. Never transmit ePHI through instant messenger or text messages. Never post any patient information on a social media site. Social media can include blogs, podcasts, discussion forums, Facebook, YouTube, Twitter, LinkedIn, Instagram, Pinterest, WhatsApp, or Messenger. Computers allow access to a vast amount of protected health information and must be kept secure. Computers should be set up so that the screens are not easily visible to the public or the patient. The computer user should log off when finished with the computer so that the screen is not left on and visible to others. Each computer user should have their own password so that each person using the computer and the screens they go to can be identified. Employees are now encouraged to report any confidentiality or policy violation to a supervisor, compliance representative, privacy officer, or compliance officer. All incidents or accidents involving staff and patients should be reported regardless of how minor they are. This type of reporting is called an incident report. Most incident reports are recorded electronically. An incident report can be triggered by an unusual injury or an error made by personnel in the department. Patient incidents are not necessarily a part of a patient record. However, they may be part of an administrative record with legal authority and can be used for risk management. A proper assessment of the how and why an accident occurred is used to prevent similar incidents from occurring. An unusual or serious incident is classified as a sentinel event. An incident should be reported as soon as it is safe to do so. Examples of incidents include patient trips and falls, reaction to the contrast, or if the patient is given the wrong medication. Incident reports can become legal documents and should also be reported to the employer's insurance companies and supervisors. Immediate reporting can be helpful in lawsuits to identify the real cause, time, or detail of an incident. Documented incident reports should never be tampered with after the fact. Most incident documentations are now electronic and will include mandatory fields. These should include a statement documenting what has occurred, where the incident has occurred, including the place and the room, the date and time of the occurrence, a list of all individuals present at the time of the incident, what actions were taken during or after the incident, the condition of the patient after the incident, and a signature of all who participated in the reporting or were present at the time of the incident.
Thanks for watching. To purchase the full course and earn your CE credits, click on the link in the description or head on over to our website at www.medical-professionals.com. And while you're there, check out our All Access Pass, where you can get unlimited CE credits for your state and ARRT renewal for just $49.99. We also offer a host of free resources to make it easier than ever for radiologic technologists like you to achieve excellence. Check out our free Radiology CE webinars, clinical reference guides, and free CE courses on our website today. Be more than just certified. Choose medical professionals.